And you should have it come up.
There it is. It's going. Thank you.
So we'll start at the top and work our way down. So we have psoas major, iliacus, iliopsoas. Okay. Pectineus. We'll do the quadriceps here. You have the rectus femoris, the vastus medialis, vastus medialis, vastus lateralis. Underneath the rectus femoris is the vastus intermedius. And let's go to the lateral portion. You have the TFL, or the Starbucks muscle, the tensor fasciae latae.
Can you say the origins and insertions of those, please?
Oh, here it is. Okay.
I won't say all of them because some of these you should say.
The major ones, yeah.
So the origin here is going to be where?
The anterior, superior, yeah.
ASIS, insertion is going to be in the iliotibial band. The iliotibial band comes all the way down and attaches to the lateral, proximal end
Of the fibula.
the tibia. All right here, tibia. Here's the fibular head, here's the tibia. Okay? If you're going to, all the quads come into the patella as their insertion. Okay? Let's go back to sartorius. Sartorius is ASIS origin. It's, look, all the way down here is going to be the medial proximal end of the tibia. Longest muscle in the body. So let's go to the posterior compartment. You have the gluteus maximus, gluteus medius. Origins are both going to be on the iliac crest. The maximus is more sacral than the iliac crest. Where's the insertion? The insertion, this is the greater trochanter, right? So that's going to be the medius. Where's the maximus? This has a broad insertion. It's going to be the greater trochanter and the proximal end of the femur. Okay. For the insertion?
Yeah, I have it.
Gluteal.
Yeah, it does. So you have greater trochanter, proximal end, all the way down into the ischial tuberosity.
Or proximal end of femur.
Yes.
Okay.
Then you have the piriformis. What's it coming off of?
Comes through the greater sciatic notch, but the origin is it the sacrum?
Yeah, sacrum. Comes all the way through. Its insertions on the greater trochanter.
Okay.
You don't have to know those. This is a quadratus femoris.
Insertion is going to be greater trochanter as well, and the origin is going to be the
ischial tuberosity.
that's right. Okay.
Then we go into the hamstrings. So once you go on the hamstrings, always keep referencing lateral medial. Okay? So we have lateral is going to be the biceps femoris. Long head, short head's on the side. The origin is going to be where all the rest of them are. Basically what? Your sitting muscles. What are your sitting muscles?
Ischial tuberosity.
Ischial tuberosity. Comes all the way down here. You can say fibular head, or you can say
Proximal head of fibula.
That's right, proximal head fibula. If you say fibular head, there's only one head. The other one's malleus. Then you have the semitendinosus and the semimembranosus, basically coming from origins of the ischial tuberosity, coming all the way down into here, into the medial aspect. You can see where they go. You can just watch them go all the way down here. So you'll just say the medial proximal end of the tibia.
Okay.
Then you go to the medial aspect. The most medial muscle on the thigh is going to be the gracilis. Then you have the adductor longus, magnus, brevis. So longus, magnus, brevis. So it's L and B. Where are they coming off of? You could say ischial tuberosity. You may also say inferior ramus of the pubis. Either one of those are okay. Yeah. The insertions are all the same. Every adductor goes to one area. It goes to that line that goes down through the femur shaft. What's that called?
Linea aspera.
Linea aspera. Exactly. All right. So then we'll go.
All of those, all four of those, including the gracilis, go to the linea aspera?
No. You'll see the gracilis. No, just the adductors. Where's the gracilis going?
To the
Proximal
medial proximal end of the tibia.
Yeah. So now we have the gastrocnemius. So they usually don't ask this, but you can go with the medial and lateral head of the gastrocnemius. I'm not going to take all this apart, but Below this on both sides you see the psoas. And if we pop that off, you're going to see this muscle that turns into the plantaris. Okay? Where do they all insert?
Calcaneal tendon.
Calcaneal tendon, exactly. Into the calcaneal bone. So you'll see that these are going to come off plantaris, and the lateral head of the gastroc is going to come off somewhere around here. What would you call that? Is it coming off the femur or is it coming off the tibia?
Tibia.
This is coming off the tibia.
Proximal lateral.
Proximal posterior lateral end of the tibia. How about this one over here?
That's going to be the medial posterior tibial condyle. Just throw all kinds of words out there.
Okay, I want somebody to tell me, is this actually coming off the tibia or is it coming off the condyles of the femur?
The gastrocnemius or the plantaris?
Gastrocnemius. Is it coming off the tibia or where's its origin? Look at its origin right there. Where is the origin? Is it coming off? Does it look like this is coming off the tibia?
Oh, it's going up to the femur.
Or is it coming off the femur?
Off femur.
So it's coming off the condyles of the femur. So you've got lateral medial condyle.
Okay.
So how would you describe it? You'd say distal, posterior portion of the condyles.
Okay, for both of them. Okay, yeah.
Now let's go to the lateral side. Always remember, here's the fibular head. So this is the fibularis. Now you only have to learn the fibularis, which is basically the longest and the brevis on both sides. Where is its origin? Could you say fibular head? Yes.
I think so.
Where is its insertion?
Insertion is it actually goes underneath, goes to the first metatarsal, right?
Well, look where it goes. The brevis comes this way, and this one goes underneath. So where does it actually go? Where's the insertion? Look up insertion. Where's the insertion of the fibularis?
Lateral.
Wait, is it going to be a cuneiform?
This is the base of the fifth metatarsal.
Fifth metatarsal. Where's the fifth metatarsal?
The pinky.
But it's the base. See how they said the base of the fifth metatarsal? Not proximal or distal.
Okay.
The base.
Okay. But the longest goes all the way to the first metatarsal.
Crosses all the way around. Right. So these are a little more easier. So you have the tibialis anterior. Where are they coming from? Actually, you see where all these are coming? This is the only one that comes off here. Partially comes off of the lateral proximal tibial. These are definitely coming off the lateral proximal tibial. So the tibialis anterior, where does it go? You can see where it goes. How would you describe that?
Talus?
Could you say the base of the first metatarsal?
Yeah.
Does that make sense?
Yeah.
Then you've got the digitorum, extensor digitorum. It breaks up into these structures right here. So it goes to digits 2 through 5. Okay, so this is the insertion. The origin we already talked about.
What's the origin is on the fibular head of the fibula?
Well, not completely.
Oh, that's the head.
This is more the lateral proximal end of the tibia.
So that's a tibia actually right there. Okay, lateral.
Below this, I don't want to pop them all up, but you have the posterior tibialis, you have the hallucis longus, hallucis brevis, and those things. They're below this. You usually don't use those as part of your test. So you usually stick with the main muscles.
Okay.
I want to grab an arm and go through an arm real quick.
Okay.
Oh, she's got it. She's not here because she's listening to music.